Welcome back. COVID-19 cases continue to surge in Arkansas and across the nation. Here's a look at another daily report of high cases from the Arkansas Department of Health today. Another 1,900 people tested positive in the past day, sending active cases near 16,000 right now. 33 more patients are also hospitalized tonight, with 376 COVID patients in hospitals across the state right now. The surging number of cases leading the CDC to upgrade many of our local county risk areas. Much of the River Valley, you can see here on this map, now in the highest risk zone area, meaning the CDC is recommending people wear a mask when at an indoor public place. Now, as cases rise in Arkansas and across the country, a warning from pharmacists. As COVID cases here in Arkansas continue to climb, those tests in your medicine cabinet may not be enough to detect the virus.
Yeah, Ian Russell with our Little Rock station spoke with pharmacists who say the precautions they're suggesting aren't anything new, but they say they work.
The summer's been busy for Daniel Cate.
The last couple months, we've had pretty large uptick just in our part of the community of COVID cases.
For many, COVID may seem out of mind, but as an owner of Marketplace Pharmacy in Little Rock, it's never left his. In fact, when cases go up, so too does the number of people asking questions.
A lot of folks have been asking about vaccinations. Should I still get one? And our answer is yes, cases are on the rise.
Those are the same recommendations he gives, whether they're seeing a spike in cases or not. But the situation has changed. We're much more prepared now than when the pandemic started.
It's not something that needs to completely shut us down or shelter our lives now, but we can just be mindful, be responsible, and take some precautions here and there.
And those precautions will sound familiar. Wear a mask, social distance, and stay home if you feel sick.
Those things that we need to do, the quarantine, staying away from people, wearing a mask, are still important for people to do.
And Pace at Kavanaugh Pharmacy says the basics work, adding that you should get tested even if you think you may have COVID. And while those at-home tests are okay, she says they're not always the best.
So it's just kind of one of those things. People need to be aware that those at-home tests have a very high rate of false negatives.
If symptoms get worse and a home test said negative, it's probably a good idea to go for one of the more accurate tests, like a PCR.
Whether you're experiencing COVID symptoms or you're just feeling under the weather, both Cate and Pace are urging you to stay home until you can get an accurate test.
It's not one of those things we should just blow off and go, it's just part of our life now. We still need to make it an important part that people are doing the responsible thing for themselves and for their community.
Was Ian Russell reporting. Here's a look at the recent infection numbers in Oklahoma. 10,000 new positive cases added in the last week to more than 1 million. That's been confirmed across Oklahoma since the pandemic began. Active cases in Oklahoma also rose by 2,000 since last Thursday. Another 30 patients died in the past week.